Hi, everyone. I'm Dr. Paul from the Health Unit. I will be delivering these messages weekly. As you know, my media briefings, we stopped them last week, but I still think it's important for us to provide the community and the media updates of where we are with COVID-19. So these will be posted on a weekly basis on Wednesdays. That will replace my media briefings. Of course, you can visit our website, eohu.ca, for more up-to-date information, but this will give you a rounding off of where we are with the numbers. So I'm going to start with my usual presentation and give you an update on where we are, and I'm going to highlight some of the changes that we've had. We're now facing in terms of our the numbers and so on. So I just want to make sure I get the sharing again. Again, I always have difficulties with the sharing. And there we go. And so I'm going to start with the local numbers. And so basically, we can see that at the local level, we have no ICU admissions and we're at 3 hospitalizations, and our numbers are really going downwards. And I'm going to show you some of the trends where we have here. Our positivity rate is down. It's about 9.9% as of yesterday. And just to remind you that this was around 30 to 40% about 6 weeks ago. So we are going on a downward trend. The same could be said for our hospitalizations. You can see that we're almost at 50, just about almost a month and a half ago. And you could see here that we're now down to 3 admissions total in our area. And again, this is a very solid downward trend. The same goes for our outbreaks. We've had almost more than 40 outbreaks actually at one point. Now we're down to between 2 and 3. Our latest one was 3. And these outbreaks are small. They're 1 or 2 people as compared to what we previously had. And again, a sign in the right direction. Well, I want to show you this. This is a new slide that we got. This shows across the province that there are 14-day decreases in health unit numbers, and you could see Eastern here is down. Our cases are going down. Most of the Ontario public health units are on the downward trend, and you could see some of the increases that we're seeing in Northwest particularly, but there's very small increases. So this is again a trend in the right direction as we move forward. At the local level again, but I just wanted to talk about the deaths, because we're up to 210 deaths. Again, we've had more deaths in wave 5, the most recent one, and that is because it's not a deadlier virus. It's because many more people got infected. And so we had days where we had 3,000-4,000 cases a day, as compared to, if you look at wave 2, where we had 300 to 500 cases a day. And so the absolute number of cases increases. Again, it's 1 death is too many. But again, this is what the deaths occurred because of the fact that we had so many more people infected during the Omicron wave that we just went through. Importantly, I just want to show you the age range. Again, sadly, it's the elderly. This is 70 plus. This is 80 plus here, and you could see that by far the majority of deaths did occur in the elderly population. And if you look at the vaccine status, most of them were unvaccinated versus vaccinated, and so so this is where we need to focus now moving forward. And I've said it before, we need to focus on the vulnerable population. If you look at our wastewater, overall, it's over the last, I would say, month and a half, we've been stable, with the exception of Castleman's going up and down. We're going to be looking at that, but we don't have an increase in correlation of cases in that area. But overall, the trends are going downwards, and we're seeing similar patterns across the province, which I'll show you a bit later. In terms of vaccinations, we're now at 88% first dose, 84% second dose, and almost 60% third dose. And you could see that the green here is the third dose, the dark green, and you can see that in the elderly we're quite high. I would like to be as high as we can, particularly 50 plus, 60 plus, because you saw exactly what I meant when I said that the elderly are the ones that are most vulnerable, and so that's an important message that I'll be raising later on. Speaking of vaccines, this is a document that came out of the Ontario Science Table that talks about the vaccine efficacy and how long long it lasts, and how does it work against Omicron, specifically against Omicron. And we know that aside from looking at case rates, among vaccinated versus unvaccinated people, we're also doing studies on antibody levels, blood tests on individuals who have been vaccinated, and then doing them serially after they've been vaccinated. And you could see for Omicron, after 2 doses, the first dose, you get a pretty good, antibody level here, and then it decreases about 6-7 months later. And then if you give a third dose, the booster, you could see it goes quite high. Even 1 month after the third dose, it's almost double what it was after the second dose at 1 month. And you can see that after 6 months, it's still quite high, even higher than the second dose after for 1 month. And so we still have good coverage at least 6 months after third dose. And a lot of people have got their third dose over the last couple of months. And so I do believe that as we approach the fall, there may be need for us to give a fourth dose. Again, that's something we need to look at, but this underlines the importance of getting a third dose. The third dose really boosts our immunity. And so that's why it's important. The more people that are third dosed, the more comfortable we'll be and the better off we'll be as we remove restrictions moving forward. This is a provincial picture, and it shows us basically the pattern of wastewater. And you can see that for the most part, everything is either going down or leveling off, with the exception of Eastern. Now, Eastern here means Eastern region that starts actually just west of Durham, Scarborough, and onto our area. So it's a bit of an increase, but it has not been correlated with a huge increase in hospitalizations. Hospitalizations are on the way down provincially, both in terms of ICU and hospitalizations. This is a model that the science table released last week that looks at possible scenarios. So if we have moderate increase in transmission because of the fact that now we've removed masking, we've removed cohorting at schools, we've removed the capacity limits and so on, with the baseline immunity that we have in the province, which is a combination of many people got infected and still have protection. Plus, if you add the higher rates of vaccination, they're predicting that in the worst case scenario, sort of moderate increase will have maybe 700-800 admissions, which is very easily absorbed in our system. We don't have to close hospitals down or anything like that to other services. You could see that it compares to almost the 4,000 that we had in the wave that Omicron caused just at the beginning of the year. If there's no increase in transmission, there's going to be flattening of those curves. So, we're best case scenario is probably somewhere in between. It's very manageable. So when we talk about being manageable in terms of hospitalization increase, that's what we mean. And the same can be said for ICU, and this is for ICU admissions, intensive care admissions, and then the models show that if you do get a moderate increase in transmission, which again, this is kind of a scenario where it takes into account people's vaccination rates, takes into account reopening and so on, removal of masks, removal of vaccine passports. You can see that it could be at the worst case scenario, maybe 250, 300 cases here. Again, far cry from what we had. We had over 700, 800 in the past wave. Best case scenario is that there's not going to be an increase. So we're going to probably land somewhere in between. And again, manageable. Manageable means that it does not overwhelm our healthcare system, and we don't need to shut down the society. That's what we're talking about when we talk about manageable. So when you look at the science table recommendations, basically, if you're looking at what's going on, the trends are downwards. They kind of leveled off, but they've leveled off at a reasonable level. We in our area are among the lowest now in terms of case rates, in terms of hospitalizations. So that's a good thing for us. And there's variability across the province. As you saw, Northern Ontario had higher cases. Obviously, they're predicting that there's going to be increase, but limited, not as much as we had in January. And then the extent of the increase will depend on vaccination rate. That's very important. And, masking, especially indoors. So despite the fact that masks have been removed, we still recommend, highly recommend that, in settings where you have a lot of contacts, whether it's closed in, where there's poor ventilation, that you should still be wearing the mask. That will help us bring that curve that I talked to you about more to the lower part rather than the higher part. Again, and that's quite important. Obviously, we know that older adults, immunocompromised individuals, and unvaccinated are going to be the most affected. And again, I can't really overstate actually the importance of getting your second dose and your third dose. Children need 2 doses, so I encourage that. We're over 85% of our 11 to 17-year-olds. We're about 50% first dose of our 5 to 11-year-olds. And so I encourage everybody, if you haven't got your 2 doses or your 3 doses, depending on your age group, please go and get them. They're available at pharmacies. They're available. We have walk-in clinics. The availability is not an issue at this point in time. So that's really an important point. Masking, and again, as you know, that the masking mandate was removed March 21st. In most settings, obviously, you need to still wear a mask in high-risk settings, hospitals, clinical settings, congregate senior living quarters, and so on. But again, we need to really understand the science behind it, okay? There's 2 ways masks work. One is that if I wear a mask, okay, basically what happens is it prevents me from spreading germs. That's the bottom line. We also know, however, that masks protect the wearer as well. So the cloth mask probably gives you between 55 and 60% protection. A medical mask, 66, 70%. That's one study that was done. And the N95 is a higher protection. So, if everybody wears masks, obviously you get chances both ways. One, I can't spread it. And B, you can't receive it. You're protected anyway. So if you have a high rate of vaccination, if you've got 3 doses and you're wearing masks in indoor settings, and there's virus spreading around, you're very well protected. So the bottom line is that there are community benefits for masking, these are studies that have been done. And so again, the masking, I want to reiterate, masking protects both the person who wears the mask and others. So the more that wear it in a context of a lot of people, the better it is, because again, although the mask mandates and the vaccine passport mandates have been removed, we are still in a pandemic. That's very important. We're still living alongside of it. So that's quite important for us to keep that in mind. And I do recommend masking certainly for the next couple of weeks to continue on. I think it'll get better over the summer. I think the numbers will start to decrease even more, but we need to see what happens over the next couple of weeks. But again, to me, it's just important to keep that in mind. And so it does. So masks really remain as an effective tool. So we're now in a transition to normalcy, not fully normal, because again, we're in a worldwide pandemic. And again, what I recommend and our health unit recommends is continued use of masks in situations where the risk of transmission is higher. We need to be logical about it, such as crowded indoor or poorly ventilated places, or when in close contact with unvaccinated or ill people, if you're visiting grandma or something like that, or elderly, quite important for that. The decision to wear the mask really should be based on an individual's risk tolerance. In other words, based on your underlying situation, underlying health conditions, your age, your comfort level, and please be kind. Some people are going to want to wear masks all the time. Some people don't want to wear masks. Either way, we need to respect people's choices. That's quite important as far as I'm concerned. And so, and I know that we also now are looking at schools. We've got, as a matter of fact, yesterday I spoke to the Catholic District School Board, and tonight I'm speaking to the Upper Canada District School Board about masking. And as you know, masking is no longer mandatory in schools, but I still recommend it, and people can and choose to wear them. Again, it'll take a couple of weeks for people to get used to it. And so I think that, we're encouraging people, if they, again, same principle, what I said before, if you judge that it's a high risk area, more close contact, you can wear it, particularly in younger ages where not all kids are vaccinated, or the younger ones that are not vaccinated at all. So it's very important to continue that. I just want to reassure everybody that the health unit is continuing to work with a school partners to ensure that, anything can go, just looking at the numbers and looking at the data, looking at other things with our school nurses. And so while no longer mandatory in schools, students, parents, and staff can continue to wear masks. I encourage them to wear masks based on their own personal risk assessment, as I said before, in situation. And importantly, and I stressed that yesterday at the school board, kids should not be bullied or intimidated in any way for choosing to wear a mask or not wearing a mask. And I think that's really important. And finally, I just want to, again, finalize this, just give you sort of a final thoughts. Please get vaccinated and get boosted if you need it against COVID-19. Be on the lookout for fourth dose. We might need it in the fall. We might need a fifth dose in long-term care facilities. Again, and then don't forget the basic tenets of public health, okay? Obviously, screen for symptoms and stay home when sick. And this applies to any illness, not only COVID. Use your rapid antigen tests as necessary. They're available now widely in grocery stores and pharmacies for free. Again, the basic tenets. Wash your hands frequently, very important. Cough and sneeze into your arm. Disinfect surfaces because the virus can't stay on surfaces for maybe a day or so, particularly Omicron. We know that. So again, those are the basic things that we talk about for any infection, any respiratory infection. And obviously wear a mask when required, because there are certain situations where you're still required to wear a mask. And obviously based on your own individual risk and on your own individual situation.